here with AIDS United and the Melanated Movement portfolio. And I have some great pieces of news to share with y'all today. I'm very excited. It's a beautiful day. I don't know if y'all are anywhere in the Atlanta, Georgia area, but hopefully wherever you are, the weather is getting better and brighter and you are feeling well. Of course, this is the Ask Dr. Christy show with AIDS United and Melanated Movement, which comes to you the second Wednesday at 1 p.m. Eastern Standard Time of every month. So of course, we'll be back in May, I believe on May 13th. Or May 6th. I'm not sure. Well, I'll tell you in a second. But what I want you to know is we are still here and we're going to have some wonderful time. So we're going to go ahead and get started. We have some marvelous questions that have come in. We really appreciate how you all have been interacting with this live segment series. We're appreciating all of the wonderful questions that you asked. And the best part about this is I really feel like it is a community initiative because we're not just getting your questions. We're getting questions from people who are loved ones, partners, family members of those who are either at risk or living with HIV, thriving with HIV. So it's always wonderful to be here in community with you all and be able to answer questions, show support, because sometimes what we need is we just need a good common sense solution that helps us navigate a situation a little bit better. So we're going to jump into our news segment. We've got some interesting things that have been happening in HIV related news. Scientists may have found a way to expose HIV hiding in the body, but it's still in pretty experimental phases, quite early. So a new approach has been shown to force hidden HIV out of dormancy so the body's immune system can detect and destroy infected cells. Now, this is very different, obviously, from what happens with antiretroviral therapy and with PrEP. These things suppress the cellular multiplication of the virus. However, we have several actually different experimental cures that are in the work. And based upon some research and some things that I was looking into earlier, some experts, not all, there's not complete consensus. They think that it's as soon as 4 to 5 years, potentially, possibly. Some other safer estimates are saying about a decade. For those of us who work in public policy, health equity, direct services, we know somebody who's living with HIV. We know somebody who's at risk at HIV. Maybe we're educators around sex, health, and wellness. We know that this has been going on a long time and it's always another decade, always another decade. So for now, we'll just kind of keep our eyes open and not get our hopes up. Another interesting thing, although not local news in terms of what's happening here in the United States, criminalizing LGBTQ people is directly undermining HIV prevention and could trigger a resurgence of the epidemic. And this is about what is happening in Senegal. So the Senegal government has taken some very anti-LGBTQ postures that have resulted in legislation and a general shift in the socio-political landscape. New laws criminalizing LGBTQ people is disrupting, according to service providers there in Senegal, access and just overall the efforts for HIV reduction and minimalization and prevention. So a law was passed last month and the impact is beginning to unfold. And this is something that we will be keeping an eye on, as we have found that typically ideologies and prejudices affect the legislative landscape, and they also affect access to resources and to care. And people of a certain ideology can be from any country. And it's very important that we keep our eyes on what our fellow states and our fellow nations are doing, because it's going to help us understand what are some of the potential threats that we need to be able to navigate. Something else that I think is really interesting is cutting HIV testing funding doesn't save money. The reason why this is relevant is that the new Trump budget has been shown, the proposed budget, and we really need Congress. So please contact your representative and your senator for the U.S. Congress. We really need Congress to step in and control how this is going to happen. Essentially, we're looking at what is roughly a $1.5 billion cut proposed by the Trump administration to HIV funding, resources, and access. Without CDC funding, testing infections could rise about 10%, says Johns Hopkins researchers, through a CDC-funded program. There are some serious concerns where they're saying as much as 10 out of 18 people could potentially be thriving with the virus within the next 10 years if such funding was cut. Now, we kind of talked shortly about the HIV programs cut, the 1.5 billion. But I want to give you some news about something that happened in Florida. So for those who live in Florida, or perhaps you pay attention to other states' legislative and social landscapes, there was an attempt at the beginning of this year to completely gut HIV funding and resources by Florida state Republicans, including their current governor, DeSantis. However, activists, organizers, academics, medical providers, clinicians, and community members, loved ones, family, everybody, they showed up in force, and they really reminded us that our voices do count. It can be difficult, it can be ugly, it can be uncomfortable, and we don't always win, but our voices do count. And if we don't speak up, there can be no victory. So in Florida, they received a victory, and HIV funding has been restored, which means that the tens of thousands of people who would have been without access to life-sustaining medication now know that that is locked in safely for them. What's so incredible to see is it's credible to see that even those who are diametrically opposed to us, with the right amount of pressure and the right amount of unity, because that should always be at the heart of the message, we can make them fold, and they will fold. So that's our news updates for the month. And of course, next month, I'll come back with some new ones, and probably tracking a few of these still. Very interested in what's happening with Senegal. So it's important for us to pay attention to how people are thinking and feeling, no matter where they live. But what we're going to do now is we're going to get to my favorite part, y'all's questions. I wait patiently all month long to receive them, and now I have them, and I'm here with you, which is my pleasure and my honor. So we will jump into our very first question. And the question reads, Dr. Christy, I keep hearing about all these advances in HIV prevention and care, and on paper, it sounds like we're making progress, but in my real life, I'm not seeing that access. Why does it feel like the things are improving, but not for people like me or the women in my community? This is a heavy question, and sitting with this for some time, as I imagine you have, can be really disheartening. But I have some bright lights in the answer for you. Number one, access is dependent on several things. So as we just talked about in the news updates, there are several modes by which the quest for a cure is being quested for, being sought out, but those are in experimental stages. They have to, particularly in most Western countries, go through a series of testing regimens, peer review, FDA clearance and approval, all types of things. So even these cures that seem to be showing initially great promise, we just have to wait. It's unfortunate. I don't know if you're a video gamer like I am. I love a good video game. I've been playing the Elder Scrolls series since I was a literal child. And I have been patiently waiting now for 2 years for the next installment of that game after the last one, which is called Skyrim. Sometimes we wait for our favorite new issue of Jordans or Nikes to come out. And patience can be difficult, but it is necessary. Now, in terms to other access, a lot of things that I hear in my work, working in community, working in policy, standing side by side with those people living with HIV advocates and educators, is a lot of people are talking about access to specific drugs, such as the once-a-month shot. I believe it's called Cabenuva. Some people are on medication that has been shown to just not be quite as efficacious and broad-reaching, for example, as Biktarvy is. Biktarvy is wonderful. And so they want to get specific drugs or specific treatment. And that might look like a lack of access. And it definitely is. I think that one of the important things that you really should do is speak with your provider and figure out what are some routes that might be available for you to get that type of access for you when it comes to prevention and care. PrEP is another one that people are just really starting to fully wake up and come around to. So PrEP is pre-exposure prophylaxis, and it can completely stop the transmission of HIV. And it's highly recommended. And so another question that you can pose is, if you have insurance, you can always pose that question with your insurance, even if it's a drug that is not specifically covered or a treatment that is specifically covered at this time. They do have a non-formulary process. What does that mean? That means they have ways that they can approve, based upon your appeal with a letter from your physician, treatments that they don't usually cover. And I think that it's always great for us to explore all of our bases. And I think that as you learn more, and maybe you have a victory with your insurance company, or you have a victory with the physician, because some cities and states, some municipalities, they offer programs. Some pharmacies that you might go through might have RX programs that will help with costs as well. So, but a lot of organizations will actually nowadays help you with PrEP for free. So for example, you can go to AIDSunited.org and go on their website, and they have a list of resources related to PrEP, places where you can find PrEP for very affordable, or sometimes even receive amounts of it for free. So of course, if you have questions ever about locating resources, services related to prevention and or care, never hesitate to reach out to myself or to any of the full-time, dedicated, wonderful staff at AIDS United. So long answer, but you gave me a heavy question, and I wanted to cover all the bases for you. We're going to go ahead and hop into our next question. This person is talking about being an influencer, basically. I have a small platform, not huge, but people do engage with me, and I want to use my voice responsibly. I just don't want to come off performative or like I'm just for posting stats. What does real HIV advocacy actually look like for someone like me? That is a great question. It's very thoughtful. And I think that in a time when there is so much performativeness and histrionics online, people definitely gravitate to content and to messaging that feels sincere. So that is wonderful that you have that in mind. The best thing I can tell you is, if you have a little platform, you could reach out to like online forums, you could check Reddit, you can go to events and gatherings, advocacy programming in your local area. If you have a platform and you're open to it, maybe you can start interviewing people who are comfortable talking about it. A lot of HIV advocates and educators and clinicians are very much so. And this can be a great way for you to spark that conversation. It seems more like you're being supportive and taking an activist position rather than being performative. But I want to say, you cannot live your life being worried about what people think about you. If you feel like the type of content you're doing right now is reaching somebody, anybody, and they're going to appreciate it, or even if just the space of advocacy around HIV prevention and care is important to you, and it should be important to everybody, then do what feels best to you. Always, as the Oracle of Delphi said, way back when, know thyself. Because here's the thing, you can't spend all your life being worried about if somebody thinks you didn't do a good enough job in standing up about a cause you feel passionate about. Because for most of us, 100 years after we're gone, because life is brief, nobody will remember. So live your best life, do your best advocacy, and we appreciate your voice, your passion, and just your desire to see a better, more healthy world for so many people. So we love you for that. Our next question. I feel like I was raised to just hope for the best when it comes to sex and relationships, like just be careful. But I want to feel more control now. How do I shift into actually feeling like I have tools and choices, not just fear in the back of my mind? So I love a question that answers itself. Great question, but you also have a great answer. You said, how do I actually shift into feeling like I have tools and choices? And that's the amazing thing. As I kind of touched on a little bit in one of the earlier responses, there are a slew of tools and resources just waiting for you. And all you have to do is utilize them. I can resonate with that first part. A lot of us, our parents tell us, like, obviously plan. We learn through life experiences to plan a little bit and, whatever. But generally, most of us do operate with a kind of go with the flow, trusting in my higher power, let go, let God kind of attitude. But when it comes to our health and our wellness, especially our sexual health and wellness, we can't take that stance. We have to be proactive participants. So I don't know if you're a protein shake person or a gym person. I take a walk for an hour with my dog every day person. I watch a cardio video. I like to hike. I like to bike. I like to skateboard. Whatever it is you do to care for your mind, for your body, we all have different ways. Well, this is a part of that. And you have the tools. You have things like PrEP. You have things like Cabenuva. You have things like Biktarvy. You have things like condoms. You have conversations, honest conversations with a physician that you can trust or an educator that you can trust who can answer those things. These are the things that make you empowered. And of course, it never hurts to ask questions, read a little medical paper, keep an eye on general, information around HIV prevention and care. These are the things that are going to equip you and shift you from that mode of fear. But fear only exists if we're not taking the steps, utilizing those tools and choices to take care of ourselves. So be gone with fear and get some PrEP. Our next question. I was traveling recently and had a situation where things moved faster than I expected, and I didn't feel fully prepared. If something unplanned happens, like protection fails, or it's just a spontaneous moment, what should I know about my options right then, especially if I'm not at home? Yeah, so this question is a complicated one because it also depends if somebody is somebody who is living with HIV or if they are somebody who is just, trying to take the right steps to be mindful of their health and wellness. So generally, I would recommend that you always, so I'm really bad. Like I'm chronically late for everything. And so when I know I have to travel, I try to pack my stuff 2 to 3 days ahead. And that way I have plenty of time, like if I forgot something that night of packing, there's 2 to 3 days before I travel where my mind is going to jog or I'm going to have something in my hand. And so whether that is like your medication, whether that's condoms, whether that's whatever it is, I really recommend, trying to make that. And it might also be a good tip for you. I keep I must have with me memo on my phone. So every time I repack, I'm checking to make sure these must-haves are on my list. And some must-haves for me are like lip balm. I must have orange Fanta. So your must-haves can have whatever you want on there. Okay. And don't feel bad about that situation. Life happens. The reality is that I don't know if you're somebody who is in treatment or if you're somebody who is, living the preventative measures. But either way, those things happen. The best thing that you can do is try to mitigate that by obviously going to get tested or making sure that you don't miss another dose of Biktarvy if you missed that day. And that was the thing you're talking about here. I also want to really caution, particularly with the fact that we've had some advances in anti-HIV criminalization measures, but I really want to caution you that when you go to other states and you're not you should be looking up what the HIV criminalization laws are for that state. If it's a state like Georgia, for example, where just a few years ago, we championed and succeeded for an action that said that, it wasn't a criminal offense for a person in treatment, aware of their status, maintaining an undetectable status, to have sexual relations with somebody without disclosing to them. It becomes an issue when you are likely to expose that person to transmission. But other states, they require full disclosure anyway. So you really want to be protecting yourself in that way as well. I just got another question in, so I want to go ahead and field that one. So I have from IG, as someone thriving with HIV, I see many people who aren't in care or taking meds because they're focused on survival. How do we reach and motivate them to get engaged in their health and care? Excellent question. Love this question. Thank you so much for asking it. We have to get in the community. I do a lot of harm reduction work. I work with a lot of people returning from incarceration. A lot of these people are in the streets, and that is an uncomfortable place to be. But if we are wanting to reach people, we have to be where they are. So you're saying they're focused on survival. So this means income housing, low income houses or homes, people who are unhoused, people who are trying to get into recovery or are in recovery. Survival can look a lot of different ways. But the important thing is that we have to have centralized messaging. We have to get our communities out in the streets. We have to get our advocates out in the streets. We need to get with local medical universities and clinics and labs to get them to do pop-ups, even if that means like a sponsored event. Additionally, we have to find, even though the church is dying in America, they still hold some sway, particularly in smaller communities that are more or less racially, demographic wise diversified. We need to get them involved as well. And that's one of the initiatives that we're doing here in Georgia, is getting those faith leaders involved. If people don't understand that this is as much a part of their survival, their thriving, their well-being, and their ability to have a enriched quality of life, they're not going to take it seriously. But also, let's be frank, we're all human. And so there's been so many times where I've seen something going on in the world and I'm like, oh, not me. It's not going to happen to me. You know, like I've driven by somebody before, because I'm a woman. I'm not stopping for no man in the middle of the night. Okay. So I've driven by somebody at nighttime and it's like a guy with a flat tire, and that's not going to happen to me. And it's happened to me. So a lot of us think that, like, oh, that's not going to happen to me, especially when we're in this survival mode. I've been there. The first large portion of my life was survival. And so we think with all the things that we're already contending with, that's the least of our concerns. So the reality is, you talk about how do we reach these people? We just do it. We reach them. We have to be out there. We have to be where our people are. They're in nightclubs. One of the things that I love about Someone Cares ATL is that they send people to clubs. People are in clubs, they're in parks, they go to events, because they want people to get tested to know their status and either be preventative or be in treatment. So that's as simple as it is. Also, one other thing. It touches on the influencer question that we had before. We need people with voices. We need people with voices, with platforms, to utilize them. People who take up space in pop culture and politics and academia, to use them. So that's another way. And we have our last question. Very excited for it. I've been in a situation where I wanted to speak up for myself, like asking more questions or slowing things down, but I didn't want to make it awkward or ruin the vibe. What does it look like to advocate for yourself in those moments without feeling like you're doing too much? The best thing I could tell you in this circumstance, my love, is that about you, you're never doing too much. Nobody, and I do mean nobody, is going to love you like you have capacity to love you. Very few people in this world are going to protect you the way that you have capacity to protect you. And when it comes down to interpersonal dynamics, my dear, and it comes down to sexual relationships as a component of that, you're never doing too much. Whether this is conversations around disclosure or consent, whether this is a conversation in the disclosure sector that is like, hey, have you been tested? You know, can I see your test results? Are you in treatment? Are you in prevention? That's fine. Or whether it comes to disclosure on your part, it is best to just do it and to solicit those questions. But I want to be clear about you. You're never doing too much. You're never doing too much. Okay. And don't let anybody make you feel like that, because anybody who is worth your time, anybody who is worth investing in anybody who takes their own health and, seriously, takes their own wellness seriously, and who cares about the health and wellness of other people, they're going to appreciate those difficult conversations. And frankly, I don't know about you, I don't want to be involved with nobody that can't have a tough conversation. That's not for me, because if we can't have a tough conversation right now just to see if we can get to the startup area, what are we going to do in 5 years? What are we going to do in 10 years? What are we going to do? So, love yourself, have those conversations, ask those questions, get your curiosity satisfied 100%. Do we have any other questions that have come in? I love it. But in case you missed the opening, I want to remind you, I'm Dr. Christy Perez. This is Ask Dr. Christy with AIDS United and the Melanated Movement Portfolio. So we do this live stream once a month, every month, rain, shine, tornado. We don't care. We're here. Okay. And we do it the second week of every month. I believe the date for May is going to be May 13th. Can I get a verification on that on aisle 2? But and so we will be doing this over the next couple months. And you have multiple ways that you can tap in, ask questions. These can be confidential, they can be general, they can be educational, they can be about a myth you've heard, anything that you want. Maybe you need life advice. Maybe you have questions that are going in your relationships or how to talk to mom. You're in a safe space, a safe place with great people, safe people, and we are looking for your questions. So you can submit those questions at aidsunited.org. You'll be able to put them there. You can also go hit them up on Instagram, of course. Please do not forget to visit aidsunited.org/melanated movement, because it's so important for us to understand the important work that the Melanated Movement is doing with AIDS United to protect Black communities, and particularly to protect Black women. So we will see you in May, and I hope to get all of your questions. Don't forget that you can send confidential, sensitive, or maybe just some advice questions to me at cperez@aidsunited.org. I'll be there, or I'll be square, and I'm never a square. So for now, I love you. You take care of yourself. You be smart. You be good. And I'll see you soon.